Hi, welcome back to the Gluten-free RN podcast. Welcome to all of our listeners from all over the world. I'm paying attention to all of the different places in the world that people are listening, and today during episode 27, this will apply to everybody worldwide. We're going to talk about the genetic connection between type 1 diabetes and celiac disease and why that's so important to know about. So stay tuned. Hi, welcome to episode 27. Today we're going to talk about the connection between type 1 diabetes and celiac disease. It's estimated in the United States that by 2050, half the population will have diabetes. We do know, per the CDC, that there are at least 29.1 million people that have diabetes. But 1 out of 4 don't know that they have diabetes. Type 2 diabetes, you can, diet and exercise. You can really decrease your risk of developing type 2 diabetes, but type 1 diabetes is an autoimmune issue. And what that means is your body actually attacks itself, essentially killing off the beta cells in the pancreas. And in order to process sugar in the body has to have insulin. And in type 1 diabetes and in type 2 diabetes, the body does not produce enough insulin to break down the sugar so the body can use it. More than 18,000 young people were diagnosed with type 1 diabetes between the years 2008 and 2009. In adults, type 1 diabetes accounts for about 5% of all of those diagnosed with type 1 diabetes. We used to think type 1 diabetes was juvenile onset or only children got type 1 diabetes. We know now that there are cases of what we call latent onset type 1 diabetes. So there are people that develop type 1 diabetes in their 20s, 30s, 40s, at any age. So we really do need to be aware of diabetes. Doctors should be testing for diabetes. And some of the symptoms of diabetes would be extreme thirst and urgency to urinate frequently, fatigue, weakness. But doctors really should be checking for it quite frequently. And I hope at this point that most doctors are checking an HbA1c or HbA1c, hemoglobin A1c, to see what people's blood sugars are over time. So why am I talking about type 1 diabetes specifically with celiac disease? The genetic overlap for type 1 diabetes and celiac disease is enormous. And I used to say very non-specifically that genetic overlap was enormous. But now several studies have come out. There's a great one, a Scottish study that came out by Mitchell and team that showed that 94% of the type 1 diabetics were HLA-DQ2 or DQ8 positive. Keep in mind that those are the same genes that predispose people for celiac disease, HLA being the human leukocyte antigen, DQ2 and or DQ8. There's also another study that actually presents that the DQ2.2 gene, which previously had been considered a no risk for celiac disease, is now considered a risk for celiac disease. So it's no longer considered a low or no risk. It's actually considered a risk gene for celiac disease. So please keep that in mind. And when they actually include the DQ2.2, the genetic overlap is 100%. So every type 1 diabetic that has been studied in these studies is actually a gene carrier for DQ2 or DQ8, which are the predisposing genes for celiac disease. Why does this matter? It's very important that anybody that is diagnosed with type 1 diabetes get tested for celiac disease every year. And when I used to give a lot of lectures on the very basics of celiac disease and how to get started, I made a big point of saying that every type 1 diabetic child was tested every year at every endocrinology center across the United States for celiac disease because the genetic overlap is so huge. Unfortunately, I hear from families and from children themselves that they're not being tested for celiac disease, certainly not every year. Some of those kids are only getting tested once and told that they don't have celiac disease. Just because they don't have celiac disease at that point does not mean they'll never develop it. It's very important that these children be screened every year for celiac disease, and especially if symptoms present that suggest that they might be developing celiac disease. So they don't have to wait for that yearly exam to be tested for celiac disease. And just because a person has a negative antibody test for celiac disease once does not rule them out for celiac disease ever. They can develop celiac disease at any age, especially people that are gene carriers of the HLA, DQ2, and/or DQ8 genes. And why does this matter? Well, these children are at risk for short stature, failure to thrive, not growing to their predetermined height. The bone health also comes into play. How healthy are their bones? Do they have early onset osteopenia or osteoporosis? Do their bones break easily? Are they rubbery so that some of these kids might be actually developing rickets, which is a bowing of the legs? And unfortunately, it's very simple to correct it, with vitamin D, calcium, and magnesium. But if these kids are not absorbing nutrients, then their bone health is compromised. It can be very difficult to maintain glycemic control or keeping the blood sugars within a healthy, normal range. Some people are considered to be brittle diabetics. Despite their every effort on their part to maintain a steady blood sugar, they have a hard time. They either have low blood sugars or spikes in their blood sugars that maybe not make sense. So it makes it really difficult to maintain a steady blood sugar. They might have anemia or iron deficiency anemia. Again, going back to bone health, all of those red blood cells are made in the bones, especially the long bones. B12 levels can be low, and it's really important to determine that if these children or people that are being tested for type 1 diabetes are IgA deficient, because we've talked in the past about people that are IgA deficient might look like they have a negative celiac panel, but if they're not producing enough IgA, then their test cannot be positive. And what we find is that it's much more likely that people that have celiac disease are IgA deficient. So that must be determined during any of the testing or even before the antibody testing. Because if a person is IgA deficient, the test for celiac disease can't be positive if you're only testing for the IgA. So that's why it's very important to test for the IgG antibodies also. And when people have type 1 diabetes, we talk about quality of life. If it's hard to maintain blood sugars or you're always getting an infection, urinary tract infections, ear infections, pneumonias, that leads to a lower quality of life. And what we really strive for is making sure that children and adults have a very high quality of life so that their life does not revolve around type 1 diabetes or celiac disease or both. But they can actually enjoy bike riding and playing and doing all the things that make life enjoyable. Several studies have been done on the correlation of celiac disease and type 1 diabetes. In one study that involved Mexican participants, the rate was 5.9%, and in Denmark, it was 12.3%. And they did note it might even be higher if they were doing a different test. So the correlation in these very specific studies shows that if you develop type 1 diabetes, your chance of developing celiac disease is much higher than the 1%. And also, if you have celiac disease that is not well treated or undiagnosed, your chance of also developing type 1 diabetes or any other autoimmune disease is much higher. That's why it's very important for people that are at risk for celiac disease, the HLA, DQ2, and/or DQ8 gene carriers are identified. This is one of the reasons that I very much advocate for people having a gene test to find out if you're a gene carrier for HLA, DQ2, and/or DQ8, so that you actually have that knowledge and you can decide whether you want to wait until you have organ damage and you have a positive antibody test, or some people preventatively go on a gluten-free diet. There's a great study that shows the prevalence of CD or celiac disease and type 1 diabetes is 20% higher than in the general population. It was a 6-year prospective longitudinal study done by Barara and the team in 2002 for pediatrics. That's really high, 20% higher than in the general population. So the overlap is enormous, and we do need to pay attention to it. And people that are diagnosed with type 1 diabetes must be tested every year or sooner, and they need to be tested appropriately and completely. Not just with a TTG2 and not just with a piece or a part of the test, but the entire panel needs to be done for very obvious reasons. Just one quick little story. I did work as a volunteer at the community outreach center where I live. And the community outreach center is for homeless people or people that didn't have medical insurance. Here in the United States, not everybody has medical insurance. So we had a relatively low-cost clinic that people could come into. And several years ago, a gentleman came in, a young man, who was diagnosed with type 1 diabetes, and he was struggling. He lived at home with his parents. He was about 27, I think, unable to hold a job. His blood sugar was all over the board and just physically looked depleted and pretty much beaten down. And so I suggested to him, as I do with all type 1 diabetics, I'm like, get tested for celiac disease. If you can't, because you don't have insurance, I understand, but at least try a gluten-free diet. See if your blood sugars are easier to control and if you feel better. After several months, he came up to me at the county fair, actually. I had a booth at that point for public education. And he came up and he said, "You probably don't remember me, but you saw me at the community outreach clinic and you suggested I go on a gluten-free diet." And he just wanted to thank me because he no longer lived with his parents. He had gotten a job. His health was much better and his blood sugars were much easier to control. So he wasn't debilitated and his quality of life went up exponentially to the point where he didn't have to live with his parents and he could hold down a job. And physically, he felt much better. And ideally, everybody should have that opportunity to feel better and to have the highest quality of life that they deserve. And why is it important that type 1 diabetics have every opportunity to control their blood sugar with tight control? Because they're at risk for many different significant health issues. And by health issues, I mean blindness, kidney failure, amputation of extremities, difficulty healing wounds, and many other health issues that include heart attacks and strokes. And that's not all for older people. That is for younger people also. So it's very important that we help people maintain a very tight control on their blood sugar. And if that means changing a diet or making sure that their blood sugar is tightly controlled, then we have to give them the tools to do that. And unfortunately, at this point in history, diabetic educators and doctors are telling people that they just have to do carb counting. And as a nurse, I find that not necessarily the best information to give people. Carbs sometimes can be empty calories or not very nutrient dense. I talk a lot about food being nutrient dense. Our body needs energy, it needs to have the correct nutrients, and if we're just eating things that are cheap carbohydrates, meaning they don't have any nutrient value, then your blood sugar is going to spike and your body's still going to be in a starvation state. So it's very important that the food choices for a diabetic or a person with celiac disease have a super good nutrient-dense profile. So for the most part, if I'm counseling somebody that has type 1 diabetes and they're struggling, we talk a lot about nutrient-dense foods or attempting to be on some variation of a paleo diet. So meat and fish, eggs, fruits, and vegetables with the emphasis on vegetables, and nuts and seeds. Many people do extremely well on that type of diet. And, you say, oh, there's not enough to eat or there's not very many choices there. But the reality is that these people feel better. Their weight is easier to control. Their immune system works better. And they're able to maintain their blood sugar at a much tighter control so that they don't have these spikes or hypoglycemic events where they pass out. And it's been noted in several studies that the current screening guidelines for celiac disease in adult type 1 diabetes patients It's not very uniform or very standardized. So it's very important that it's not just the children with type 1 diabetes that get tested for celiac disease every year. It's the adults too, because the risk of celiac disease doesn't go away when pediatric patients become adult patients. That risk stays the same. It's really, really important that we continue to test people for celiac disease or allow them to make a choice as far as just proactively or preventively being on a gluten-free diet. Because we know that once you have one autoimmune disease, which both celiac disease and type 1 diabetes are autoimmune diseases, your chance of developing more autoimmune diseases is 30 to 50% greater. What are other autoimmune diseases? Multiple sclerosis, lupus, Sjogren's, scleroderma, autoimmune thyroiditis, Graves' disease, Hashimoto's, vitiligo, Raynaud's. The list goes on for autoimmune diseases. And we really have to be very careful about making sure that people know that the risk of developing more autoimmune diseases once you have either celiac disease or type 1 diabetes is enormous. If we can give people an option to prevent further autoimmune issues, then they really need to know that, there's a possibility just by changing their diet or adopting at least a gluten-free, dairy-free diet, they might be able to mitigate some of that risk factor. And I just got back from a SIBO conference, which is SIBO, or small intestinal bacterial overgrowth. What we're finding is that the intestinal microbiota actually has a huge impact on our health overall and may be an influence in turning these switches on for things like celiac disease or type 1 diabetes. We know that the trigger for celiac disease is eating gluten, wheat, barley, rye, and oats. That trigger is known. But what we also know is that sometimes there's a stress to the body. It can be a cold, it can be food poisoning, it can be traveling and eating different foods. It can be any stress to the body that can trigger people into an autoimmune disease. And sometimes we have to really think about what it was that triggered people into that autoimmune component of the disease. And sometimes it's an antibiotic. The correlation between a change in the microbiome in the intestines is being investigated quite a bit in the research. And that correlation is going to be found to be very high. And any change in the microbiome in the intestines or in the body can be a trigger for the autoimmune component. So we'll talk more about the microbiome and small intestinal bacterial overgrowth in a future episode because it has a huge impact on our health. Small intestinal bacterial overgrowth is a concern for a lot of the people with celiac disease proper, and we're finding it in many different segments of the population. And it needs to be treated either with a diet change such as a low FODMAPs diet or a specific carbohydrate diet, sometimes with an antibiotic called rifaximin, and sometimes with herbal type treatment plans that include berberine or allicin or neem. So there's different ways to treat it, but you have to work with a practitioner. You should have a breath test for methane and hydrogen. Again, another thing that we're going to talk about in future episodes. But the reality is that we really have to focus on healing the intestines, healing the leaky gut, building up the immune system, and making it easier for people to maintain a very tight control on their blood sugar. Unfortunately, I see out in the community and some of my clients that have blood sugars that are way out of control, or they're all over the board. They go down to 50 and they have to drink orange juice or they pass out. Some people like to maintain their blood sugar at a really super high rate so they don't get a low blood sugar and pass out. That's not very healthy. That's not very good for your kidneys or your eyes or your capillaries and your fingers and your toes. Neuropathy or nerve damage is another thing to be concerned about. And also gastroparesis, which is a delayed emptying of the stomach, a neurological disorder. There are many different ways that a high blood sugar or a very poorly controlled blood sugar has huge impact on the body overall. So it's very important that we identify these people, number one, that might also have celiac disease and need that further diet change where they're eating whole foods such as meat and fish and eggs, nuts and seeds, with an emphasis on vegetables and some fruit. The other interesting thing, and I find this fascinating, and we'll probably do several episodes of type 1 diabetes and celiac disease because there's a lot of information to cover. It's really important that people realize that a lot of the children that get diagnosed with celiac disease on top of their type 1 diabetes would say they had no symptoms. That means that they would say they don't have any diarrhea or constipation or abdominal pain, and they feel fine other than their type 1 diabetes. But an overwhelming number of these children actually have celiac disease, which means they have intestinal damage. They have villus atrophy or significant inflammation in their intestine. If people have a leaky gut, we really have to work very hard at healing up that leaky gut and making sure that it's not leaky anymore, that increased permeability of the intestinal wall is healed for many reasons, because then it becomes a systemic issue. Systemic means it affects the entire body. The correlation between type 1 diabetes and celiac disease is well researched way back into 1969. So if you're interested, you can go back and look in the archives on the National Institute of Health website or PubMed and check back and see that there is a long history of a correlation between type 1 diabetes and celiac disease that has been recognized. So if your endocrinologist or your primary care provider is not testing you every year, you might want to consider that they do some research to find out what the current recommendations are. I included a study on the podcasting notes entitled The Prevalence of Celiac Disease in Libyan Children with Type 1 Diabetes Mellitus by Ashabani and the team from a study in February of 2003. And basically this study showed in the conclusion that the prevalence of celiac disease in diabetic children in Libya was found to be higher than in several European countries. Serological markers are useful for identifying diabetes mellitus patients who should undergo a small intestinal biopsy. The prevalence of celiac disease in this study was 10.3% in children with type 1 diabetes. Since I referenced the study earlier about the celiac screening in Scottish cohort of children with type 1 diabetes mellitus, is DQ2 typing the way forward? I'm going to read just a little bit of that study, and it's Mitchell and team. And this study was done in November of 2015. Overall, DQ2 and DQ8 alleles were identified in 94% of the patients. What this study really was looking at is whether it was cost effective for the Scottish government to actually pay for genetic studies for HLA DQ2 or DQ8. And what they found was that the HLA genotyping was not even indicated for celiac disease screening in this population because the correlation between the genetic overlap was so huge. So they said, we're just going to assume that these people that have type 1 diabetes are gene carriers for the HLA DQ2 genes and move forward. So let's just review just a few things. What we know about celiac disease and type 1 diabetes is the genetic overlap is in some studies 94% and in other studies 100%. So every child or every adult with type 1 diabetes needs to be tested for celiac disease every year. And if they also need to know that they have the option of adopting a gluten-free diet. And the gluten-free diet is preventative for developing celiac disease proper and all of the other medical issues that go along with that. And ideally, what it would do is also prevent other autoimmune diseases from getting triggered. And because the genetic overlap is so huge, once we get these people identified, we also need to make sure that their families are tested. Keep in mind that there is never just one celiac person in a family. And I highly recommend that everybody in the family get tested for celiac disease, maybe every year, including twins, adopted children, husbands and wives, everybody. Because at least 30 to 40% of the population are gene carriers for the HLA-DQ2 genes. And it's not just white people, it's every ethnicity. And please pay attention to that. I can't tell you how many times this week somebody said, well, they can't have celiac disease because they're African American, or they can't have celiac disease because they're from the Middle East, or they can't have celiac disease because they're from Asia. So it's really important that everybody understand that everybody is at risk for celiac disease because 30 to 40% of the population worldwide are gene carriers for celiac disease, thereby at risk for type 1 diabetes and every other autoimmune disease. So if we're going to talk about prevention, we have to talk about the genetic correlation, and then you have to act on that. And we have to make sure that our doctors actually have this information. So you can always print off any of the studies that I've included or do some research yourself, especially for any of the patients that have a hard time maintaining a blood sugar. And even in the absence of a positive antibody test, it is completely okay to adopt a gluten-free diet proactively or preventatively. A lot of people find that it is much easier to maintain a really tight control on their blood sugar once they're eating a whole food diet. And as a nurse, I remember way back when, I'm giving away how long I've been a nurse, we used to really encourage people to basically adopt a paleo diet, to eat a whole food diet, very simply made, meats and fish and eggs, focusing on vegetables with some fruit and nuts and seeds. For some reason, education has gotten away from that. And I can tell you that even in our local diabetic education services, there is no education about the correlation between celiac disease and type 1 diabetes. And I want you to go back to your diabetic educators and ask them what they know about the correlation between celiac disease and type 1 diabetes, and not superficially. I want them really to know and have an in-depth understanding of what the correlation is. Because if they don't, they need to get educated. They need to have this information. So print off those studies that I've included, do your own research, and when you're doing your research, do spell celiac disease both ways, CELIAC, and also COELIAC. You will get different studies. And when I did that study just recently, I just put in type 1 diabetes, celiac disease. I came up with over 600,000 hits. So there's definitely a correlation. And if the people that are actually educating about type 1 diabetes don't know about that, then they have to be educated themselves. So do what you can and help me educate the world about type 1 diabetes and celiac disease in general, because it is grossly underdiagnosed and underrecognized for what it is. And at this point, it is a public health crisis, and we really do need to identify these people. Again, going back to the point that it's estimated by the CDC that 50% of the population will be diabetics by the year 2050. And as a nurse, that's not a very comforting thought. And I can tell you that there are a few entities that are very excited about that. Some would be the drug companies, and others would be the people that make the, diabetic supplies. This is really huge market for them. So if we can actually take away some of that market by preventing type 1 diabetes and or type 2 diabetes, which I will also deal with type 2 diabetes in a future episode, let's do some preventive medicine. Actually, let's do some preventive eating of gluten-free food or considering a paleo diet. A super good high-fat, nutrient-dense diet that could prevent somebody from getting their fingers amputated or their feet amputated, kidney failure, blindness, infections, early death, stroke, heart attacks. That list goes on too. Ideally, we would be much better at this, and we have a lot of work to do, but we're doing it. We're educating, we're talking about it, we're making sure that people have the correct information. And I thank you very much today for listening to this episode 27 on type 1 diabetes and celiac disease. If you have any questions or comments, feel free to email me at Nadine at glutenfreern.com. And if you really like this podcast, please leave a review on iTunes or Stitcher or wherever you listen. I will very much pay attention, and I very much appreciate any of that feedback that you give me and the ratings. It also helps people find the Gluten-Free RN podcast. And I also like to thank everybody that listens worldwide. Thank you very much to Tim Hallowell, my executive producer of the Gluten-Free RN podcast. I appreciate his input in making sure that we are on time every week for getting an episode out on Friday at 9 a.m. Pacific Standard Time. So thanks again, Tim. And until next episode, I'm Nadine Griskowiak, the Gluten-Free RN, working hard to make sure that you have the right information that can help you be the healthiest person and have a super good high quality of life. Bye for now.